for coming. I appreciate the turnout. Thank you very much. I think I've got the benefit of a few of my students, past and present on the side here as well, so thank you very much. Okay, so my name is Melvin. I'm a lecturer at UCM in Health and Social Care, but I'm also a PhD student at the University of Chester. So I'm a fourth year part-time PhD student. I've been looking at the eye condition nystagmus. So my study is a multi-method study of the impact of nystagmus on the lived experience of adults within an island community. The reason it's a multi-method study is I'm looking at both clinicians and patients. So there's two sort of data sets there. So I just thought I'd tell you a little about nystagmus because from I have nystagmus as well, but I will come back to that in a minute. So from my research, I know a lot of people don't know a lot about nystagmus, and there's not a lot of literature in terms of actually the patient experience living with the condition. There's quite a lot out there on actually, the biology of the eye and things, but not necessarily about living with it, some of the daily problems. So nystagmus is characterised by involuntary eye movements, so and reduced vision. So here's just kind of a picture here, just to show the different ways nystagmus can present. It can present in a side-to-side motion, up and down, circular. So there's lots of different sort of subtypes of nystagmus, but and lots of different causes. But essentially, it is involuntary eye movement, leading to reduced vision. There are, from kind of further research into this, my lit reviewing things, there's 45 subtypes in the medical literature of nystagmus. So you can imagine it's quite complex to sort of unpick. And to add to that, there's sort of two broader categories which we can talk about. But essentially people can be born with the condition or it presents very early on, or they can acquire it. And I spoke to patients with both of those, both acquired and early onset, and obviously they've got slightly different experiences. So this is an adaptation from Dunn, just to try and explain the types of nystagmus before I go into kind of my research. So acquired nystagmus, you can see here, acquired is obviously acquired later in life. Sorry everyone, it's a bit too long. Right, so acquired nystagmus is acquired later in life. So it can be any time in life that it can develop, and it's a bit difficult to try and pinpoint kind of when it would be acquired versus when it would be early onset. But the sort of, in the medical literature, it tends to say that sort of from 4 months onwards, they can consider it to be acquired nystagmus, and they would look for certain symptoms that you wouldn't get in the early onset. So as people develop acquired nystagmus, as they get a bit older, or if they develop it in later life, people with acquired will tend to see, when the eyes move, the world moves, so that's called oscillopsia. So they tend to see the image move, versus people with early onset, the brain adapts and they never generally see the eyes moving or can't actually feel the eyes moving. So there are some subtle differences to look for. Acquired is usually through like a stroke, MS, brain injury. Certain prescription and recreational drugs can cause nystagmus to happen as well. Early onset, which is probably more common, I only actually spoke to one person with acquired. Early onset is more common. That is again split further into infantile idiopathic and infantile identifiable pathology. So there's a huge group of people with infantile nystagmus that they don't know the cause of. So it's idiopathic, they're not sure of the cause. And then there's a group of people where there is an identifiable pathology for it, often presenting with people that have other conditions as well with that. It is the most common, early onset is the most common eye condition in school-aged children, which you wouldn't necessarily expect because it's not that well known. Confusingly as well for me, doing my literature review and literature searches, they also changed the name of early onset nystagmus. So it used to be called congenital nystagmus. So a lot of the older literature will refer to it as congenital nystagmus, but they've kind of discovered through further research that it kind of presents within 3 months, usually from 3 months onwards. So they call it infantile nystagmus syndrome now. Okay, so you can imagine sifting through all this literature, and there's 2 names for it, plus 45 subtypes. So there's a lot, there's a lot to pick through. Okay, so hopefully that gives you a little bit of an idea about nystagmus if you didn't kind of know about it before. So my research question is, what is the impact of the lives of adults living with nystagmus in an island community? I wanted to keep it specifically to the Isle of Man. There's limited research anyway on patient experience, but there isn't any at all on the Isle of Man. So it was nice to be able to do it here. So theoretically, so my background is kind of sociology, psychology, and social sciences. So the lens I used for this here was symbolic interactionism. So this focuses on how individuals construct the meaning around the world around them, and the objects and experiences. So rather than being a kind of like some methodologies kind of look from the top down, like a kind of structure, looking at the structures. This focuses on the individual and how they kind of interpret the world and see the world. So that's great for trying to understand how someone experiences a condition. Okay, so within that, I used biographical methodology. So this is essentially using interviews or getting whole biographies of people. So whereas you might traditionally kind of ask them about the area of interest, with biographical interviewing you ask them to give you their kind of whole life story, and they sort of discuss the area of interest within that, and you kind of pull that out. So it's good because you get to see what they think is important, and you get to go from kind of birth through to school, working life. So it's great for getting that, capturing that whole picture. So that's what I utilised for this. And there were semi-structured interviews essentially, but and what you usually do with biographical research is you ask an opening question, like a grand question, and let the individuals talk kind of quite freely, and then kind of come back with some other questions and sort of hone in on some other parts. So I found that very useful for what I was doing here. So obviously it's purely qualitative, my research. I just wanted to talk really quickly about positionality and reflexivity. So in qualitative research, especially research that's purely qualitative, we have to be really careful that, we have to be aware that as researchers we're not neutral in that research, and we are part of that research. If we're working in a lab, we can be slightly more detached from that research to some extent. I mean, not completely, but with this, I'm kind of immersed in this. So Wilson, James and Williams defines positionality as the researcher's acknowledgement of their assumptions related to the research topic and participants, and reflexivity encourages researchers to question and address these assumptions. So it's this idea that we're constantly questioning, how much of influence am I having on the research? When I'm interviewing people, how much of me am I putting onto that, and am I tailoring the questions to my own worldview? So being aware of that kind of helps sort of increase the validity in some ways of the study. Those discusses the inside and outsider debate, highlighting that the insider may better understand cultural experiences. So part of this, because I have the condition, so I have like early onset nystagmus, there's a debate around whether that's a good thing or a bad thing in qualitative research. The idea, the pro for it is that I have a kind of an in with the people that I'm talking to, and they're more likely to open up to me. The other part is I kind of almost know too much to start with, so maybe I'm putting some of that onto the research. So it's that debate, but from what I found, generally it was a positive thing, because participants would say to me, I've never met anyone with this condition before, or I'm really glad you've got the condition because I don't have to worry about thinking of my eyes are wobbling in the interview, and I don't have to worry about that because I'm not judging them, So people find it quite a positive thing. So that was something that I did consider when I started, how would that affect the research? Yeah, and it enhances the researcher's empathy. Okay, so I will go through the study and then I'll talk about some of my findings. So my sample so it's about 1 in 1,000 people with nystagmus. So not that rare medically, but actually, if you think about our population, it's not that big, and then it's 1 in 1,000 people. So my criteria was people over 18 who lived on the Isle of Man. They didn't have to be born here, but they had to live here for enough time to kind of experience living here. And they interviewed clinicians from the Isle of Man who had worked with nystagmus patients. I used non-probability sampling, recursive sampling, so that's just sampling that basically I'm choosing the participants. Okay, so I can't really have a random sample because I need people with specific criteria. So I'm choosing people based on an inclusion criteria. So a total of 15 people I interviewed, so there was 10 patients and 5 clinicians. It worked out that there was actually 5 men, 5 women and 5 clinicians just by chance, so that was quite nice. So when I've been analysing it, I can kind of analyse it in those groups and then as a whole as well. My initial campaign, so I used like a media campaign, and I went through local optometry practice to recruit participants. I initially reached about 36% of the available population with nystagmus, but quite a few dropped out. Some people dropped out when they realised they weren't getting paid. A few people did that. I never heard from them again. And then some people you just don't hear from. So you do expect a dropout rate. But in the end, it ended up being, so excluding the clinicians, the 10 participants is about 15% of the adult population with nystagmus on the island. So still not too bad for such a small sample of people. So as I said, it's estimated there's about 1 in 1,000 people with the condition, and as I said, it's about 67 people, I think, on the island with the condition. But that is just from me doing calculations, and there is no actual record, like complete record, obviously, and if people have acquired it, it might not be registered. So it's quite a complex condition to nail down how many people actually had it. Okay, so just a little bit more about this. Oh, that's not. Okay, so analysing data. So this is quite fresh because I've just analysed it really. Probably not finished fully, but I've analysed a good chunk of it. I used inductive thematic analysis. So because it's purely qualitative, obviously you've just got 100,000 words basically to sort out. So you've got to do something with that. So I used thematic analysis. So inductive thematic analysis is basically you approach the data with no kind of preconceptions. You're not going there with codes. You're going there with nothing, just your research question. And you essentially go through, you label all your data. So every time someone says something, you label that data as to what they're saying, not really assigning much meaning to it at that point. Obviously, I transcribe the interviews, and then label the data, and then from that, you go through the data again. You look to see if any of these codes are kind of common or similar areas, and then you start to put these into broader themes. So where you might have a few hundred codes, they become maybe 4 or 5 themes that fit into there. And you have to. I was having a conversation with some of the researchers earlier this morning. You do have to let go of some things. You think there might be this amazing theme, but when you actually look through the data, there's not enough evidence for it to actually be a theme. So it is quite a long process. And then obviously I'm going to show you some direct quotes and things in a minute from participants. I've tried to include these bits because I know there's research students in here that are maybe doing research or about to do research, but I did actually use in vivo for my data analysis, which is a data analysis software for qualitative research. And if you're ever going to do something, I would advise just spending that bit of time to learn to use it, because what it essentially does is where you would have kind of gone in by hand and highlighted things and kind of cut bits of paper up and put them, done it all by hand. Every time you highlight something to a code, it keeps that quote under that code in a database for you, and then you could then condense those codes into themes, and then you can generate graphics around those themes. And so that's just kind of a note for students if you're thinking of doing any research, it's worth learning in vivo. There's a lot to it, but the basics of it are very handy. It will auto-code as well, so you can click auto-code and it will use AI, but I found that was a bit random what it came up with, because it's just looking for patterns and things. It doesn't have that human subtlety there. Okay, so let's get to some. Right, so I just want to go through some of the participant findings. Obviously, they're anonymous. So one of the themes that I developed was frustration around treatment of the condition. And this was from both clinicians and patients as well. So it wasn't just kind of like the patients having a moan and then the clinicians not backing it up. It was from both sides, interestingly. So interviewee 14 said, I don't think there's a good communication. Interviewee 14 was a clinician. I don't think there's good communication between clinicians, optoms, everybody involved really. So they went on to talk about their frustration around people with nystagmus, particularly adults. Because there's kind of limited treatment options, they felt that once people became an adult, they kind of got lost in the system, but they still did need support around the condition. But because there kind of wasn't any that much treatment available, they were sort of left to it, and she said she mainly kind of saw children and then that she didn't see them again. Interviewee 6 said, I feel that they don't listen, so I deliberately type everything out before I go and I put it down. They won't look, but you've got to push them. So they felt real frustration about kind of not being listened to when they went to seek treatment. I'm just saying, well, this isn't all on the island either. So although they were based here, some of this was people going to the UK as well. But that participant felt that there was a real frustration about not being listened to and kind of the condition not being understood. And I think because it is quite, although it's not rare, it's quite people, some clinicians maybe don't know that much about it, so there was that feeling of frustration. And even some of the equipment that's used isn't actually suitable for nystagmus, so where you would normally use various equipment to look at the eye, you need a still eye for that. Nystagmus patients can't do that, and there isn't really an option. So, for example, looking at peripheral vision, you can't really do that with a nystagmus patient. Sometimes nystagmus patients can almost cheat because their eyes don't stay still, so they see the peripheral and they shouldn't be. So things like that. So there was frustration there. Interviewee 4 said, when I look back, the management and support I got was rubbish, but I only really knew that because I have comparison now, and I know a little bit more. So that individual son had it now, so a young child, so he was under 18, but she did feel like it was getting better, because from when she was younger, she felt like she got no support, but she did say that her son was getting more support at school and things. So I think there's that idea that there's a shift, things are getting better for support, but there is still quite a bit of frustration around it. Okay. So there's this other theme, kind of rejecting the label, so there's a load more examples of this one. But there was this other element of people wanting to reject the label of nystagmus. So a lot of people talked about not telling people they had it, or I didn't put that into their, I didn't say about label. People kept talking about this label. So interviewee 14 said, people don't like being labelled. Always, I think it's very hard if you put a label on somebody, very difficult to take the label off. Now, that was a clinician. Again, it's the same one, but other clinicians said this. I just came away with that. They did. But because this was at early stage where I didn't have as much data. But she was talking about how a clinician that they work with in the UK tended to just label the child as partially sighted straight away without knowing much detail about it. So I think there's like an ophthalmologist or something. And their argument was that we should wait because there was no actual kind of there was no benefit really to labelling them that early on. And they could be labelled later, but it was harder she felt it was harder to take the label away. So I don't know, there's probably the school of thought there as to both ways. You could argue either way there, I think, but she felt that it was best to wait, see how much the child can see, and then decide, what to label them as, kind of, rather than just labelling straight away as partially sighted, even though they weren't 100%. So that was an interesting one. This participant said, I don't think the running theme is actually that having. I don't think the running theme is actually that having. Sorry. Right. I don't think the running theme is actually that not having the label with limitations is better. So this is the thing with transcribing directly what people say. People say quite odd things. All the researchers probably realise this. And if you kind of transcribing verbatim, that you get some odd phrases. But anyway, what she was trying to say was, it's better to not have a label in the context of that. So she felt that not having the label was better. Okay. Okay. Right. So there's another theme about lack of knowledge surrounding the condition. This was a really big aspect. Again, clinicians and patients. There just didn't seem to be that much knowledge around the condition. I think it's because, like I said, once you're an adult, there is treatment, but it's not widely available. And one of the clinicians also was talking about kind of, it's not one of the kind of maybe neuro-ophthalmology is maybe not one of the exciting areas to maybe go into, and there's not that much funding in that area. And as an adult, they can't do that much. So I think that was why. But there was a lack of knowledge from both sides. So interviewee 3 said, I never even knew the word until about 10 years ago, the word nystagmus. I just used to say, oh, I've got jumpy eyes. So they had nystagmus, but had never been either told by family or, there was a brief meeting with a clinician and they'd never really discussed it. I will say that this tended to get, the younger people tended to get better. Particularly people that had children now, like I said, the children were getting much more support at school. Interviewee 1 said, no one ever told me until then, no doctor, no parent, no family member. This person didn't know that they had it at the top here until later on in life. They actually, just because they were involved in an incident and their sister said to them, oh, you must have been really nervous because your eyes did that thing that it does when you're nervous. And this participant said, what do you mean? She had no idea. And sister said, oh, well, your eyes wobble when you're nervous. Now, when you have nystagmus, your eyes wobble when you're nervous, and when you're tired, they're more pronounced. So she only found out by chance about that. So it doesn't seem to be kind of discussed or talked about. Okay. Interview 4. Mine is congenital idiopathic nystagmus, and that's all I knew. I didn't really delve into it too much. So obviously they were slightly younger. They did know some of the name of it, but they didn't know any more than that really. And their family didn't really talk to them about it very much. So they kind of didn't have that much knowledge surrounding it. Okay. Okay. So just a couple more. There's just this is the last kind of bit about the participants, and I want to quickly just finish with some recommendations and a little bit of analysis. And so, good thing is, the nice thing that came out was that resilience was a really big aspect of the study. So people being really resilient, and I've called this theme the card I've been dealt, because that's what one of the participants said, which I think is like a really nice turn of phrase. And it's quite nice for qualitative research. You can be a bit like creative in that respect, but that really sums up that feeling that we got from this research that I got. So interview 3, I don't think about it. It wasn't something I woke up every day thinking about. I forgot about it. So although they maybe hadn't been told much, people kind of got on with it and didn't worry about it too much. It didn't faze me anymore. Probably did when I was younger. People aren't bothered. It's just in your head. It's all in the mind. So I quite like that one. That person kind of just wasn't too concerned about it. Yeah, interview 2. For me, I'm not bothered by it. So a lot of the time I won't raise it. Yeah, I was younger. I used to in school. Again, that's another one of those where it's directly what they said. So it's a bit doesn't make sense. But what they're saying was they're not bothered by it, and maybe in school it was. Interview 6 said, once you've got the nystagmus, then really you're stuck with it. It's up to you to adapt your life to cope with it. So again, there's real kind of resilience around it. Interview 4, I might not see everything regardless of my nystagmus, you know. I think that's just the card I've been dealt, and that's where I got that theme from. Because a lot of them talked about they didn't know any different, so why should they let it kind of worry them? So I thought that was quite nice that there was certainly some negatives, but then there was a lot of positives around people just sort of getting on with it. Interestingly, in my lit review, there was one similar study, and the only one similar, and they found completely negative results, interestingly, but I found quite a lot of positive out of it as well now, and I don't know later on when I kind of analyse this further, is it maybe island community, is there some element there that's different, because that other study was done in Leicester, so it was just interesting. This is just a really, really quick note, not really a theme or anything, but it was harder to get men to open up about the condition than it was women, which is kind of textbook, isn't it, really? We know that men tend to report illness less so than women, or when they do, it's often more severe, isn't it? You know, they'll leave things longer. So this kind of just backed up that idea. So men would sometimes, the male participants, I'd say, so how does it affect your social life? And they'd be like, it doesn't. And I'd say, okay, well, I'd give them a scenario. And they'd say, oh yeah, well, when I meet my friends, yeah, I ask what colour coat they're wearing, and you know, you had to, so the male participants, they did have to really push to talk about the condition. But that backs up that kind of gender idea about health. So I just thought that was interesting. That was kind of a running thing throughout. But it's quite funny because these are obviously people that have signed up to do the study, and then they're saying like, oh, I don't have any problems. I don't have any problems. You'd expect them to kind of come with some. Okay, right. I have no idea of time, everybody, but I'm just going to do this last little bit. So in terms of analysis, so I'm using a symbolic interactionist lens, so that's just, like I said, building a picture of how people interpret the world. So I'm using Goffman to kind of analyse some of the data, and Goffman says here in a very wordy way, I'll just read it to you. The individual who presents himself wish to think highly of him, or to think that he thinks highly of them, or to perceive how in fact he feels toward them. Thus, when an individual appears in the presence of others, there will usually be some reason for him to mobilise his activity so that it will convey an impression to others which it is in his interest to convey. I feel like he could have probably said that a bit more straightforward, but luckily we're kind of gone over the days of, I think, academics maybe writing like that. But essentially what he's saying is, we act in a way, we don't act in a true way necessarily, we act in a way that we want to be perceived by others, so we're kind of, he calls it like impression management, we're controlling impressions of people, and I feel like this links quite nicely, and he talks about stigma as well, and this links quite nicely with this idea of people kind of hiding the condition or not wanting to mention it so they're perceived in a certain way, because they feel like maybe when they are, if they open with I have nystagmus, that's kind of how people will perceive them. So I thought kind of his work fitted nicely. I need to do some more analysis of this. But he also talks about kind of front and backstage and that, you know, out in the world is the front stage, and we kind of put on this kind of show really, and then backstage we're actually a different person. And that's kind of what people seem to be doing, and in managing our impressions of people. And there's further research, like French talks about denying reality of impairment. So there's lots of other scholars that have gone on to talk about this. Okay, so that's kind of in its early stages though, that bit. But I just wanted to kind of use some of the theoretical parts of it to help explain it a bit. So last bit, so initial implications of the research. Like I said, linking back to my lit review, there was definitely, I found slightly different, well there's not much research out there anyway, but mine has found some positive aspects of nystagmus. It needs to be looked at further, whether that is because we're on an island community, I'm not sure, but I've found some slightly different things. There are some crossover with my lit review as well. Yeah, so next forward, there's clear positives. But what's coming out as well is that there's definitely more awareness needed of nystagmus from the clinician and the participant. I didn't show you all the quotes, but there was a lot. Every clinician I spoke to said that there needed to be kind of more awareness around the condition, more sort of joined-up thinking, you know, more training and that kind of thing. So there was that running theme. So I'm hoping this is going to sort of increase the knowledge, just by increasing awareness, increase the knowledge of the condition, and hopefully improving individuals' experience. There's a whole kind of theme of sort of education, which I haven't really explored yet as well, where kind of depending on how much support people got at school, that seemed to impact, you know, obviously, as you'd expect there, how well they did. And I think one thing I'd like to do is set up a local support group. There isn't a local support group for nystagmus on the island. There's UK-based ones and US ones that people have joined, but there isn't a dedicated Max one, so that's something I'd like to do at the end. And I think that the other main thing is it actually, everyone I spoke to said they'd never met anyone with nystagmus before, so it brought quite a lot of people together, you know, that had the condition, and we got to talk about it from that respect as well. Okay, so thank you very much everyone.